This is a study that I wanted to, not really a study, it's really a review of a QI process that was put in place in a hospital in Wisconsin. And I really thought it was interesting and really drove home the point of how you actually can implement public health interventions in an emergency department. So this was an interdisciplinary team that was putting together a QI process because they wanted to increase their pediatric flu vaccinations in the emergency department. We all know how important flu vaccines are, and unfortunately, we know that oftentimes most people actually don't get a flu shot every year. So this team was trying to do something about it. So they put in place a plan to study X cycle process that works. So they actually did 5 things. They mandated vaccine screening by their nurses. They created a nursing administration protocol for the vaccine. They put in a lot of effort into educating providers, nurses, and families. They involved their pharmacy team as well and created a pharmacy workflow. And there was weekly staff feedback as far as what staff were experiencing, what they were concerned about through that process, things like vaccine wastage and the time from a nurse saying someone needed a vaccine to a provider actually talking to the patient and saying, yes, they should get a vaccine. So they worked through all of those things, and they had pretty positive results on the next slide. So their screening actually went from 0, they weren't asking anyone in the beginning, to about 90%. 90% of their patients were being screened for flu vaccination eligibility. And they actually were able to improve their vaccination rates by about 8.5% in eligible children. About 80% of the vaccines that were given were actually children who had Medicaid. And what's really important and interesting about this, there was no significant increase in the ED length of stay for those patients. And they actually added, it's okay to make some money. They actually added a little bit of money, a couple dollars, $22,000 in hospital revenue over the span of 6 months. So I think my point here and why I put this in here is I know that often public health interventions in the emergency department, when you're just trying to kind of keep patients flowing, can seem overwhelming. But I really think, and I hope that this pandemic has taught us that oftentimes the emergency department is the only place where particularly people who are from marginalized groups are going to seek care for various reasons. Transportation, they lost their health insurance, whatever it may be. We have to really see the emergency department as a golden opportunity to do the best thing for people and to improve their care and, quite frankly, to protect the public's health. And I think, again, this is something that I hope everyone has learned from the COVID pandemic. I know it's not easy, but I think with intentionality, it can actually be done.